Good afternoon and welcome everyone to our webinar titled Health or Wealth, a Global Perspective in Responding to COVID-19. This webinar will explore some of the ways in which a full pandemic would lead to economic downturns, as well as pose major challenges to the global health agenda. This webinar will also delve into how the coronavirus pandemic will take a heavy toll on the world economy and global health frameworks alike. It also intends to explore tackling COVID-19 through both global health and global economy approaches. Our first speaker, Dr. Shadi Saleh, is an Associate Vice President for Health Affairs and the founding director of the Global Health Institute at the American University of Beirut. Additionally, he is a professor of health systems and financing at the Faculty of Health Sciences at AUB. Dr. Saleh's areas of expertise are in healthcare systems and financing, evaluations of innovative healthcare interventions, as well as building a business case for quality and healthcare access and equity. Dr. Saleh, thank you for being here. The floor is yours.
Thank you. Hello, everyone. It's a pleasure being with my dear friend Richard on this important webinar. The reason why we have decided to do this webinar is that because most of the discussion globally now is on global health versus global economy. If you look at the coverage in the news, if you look at the concerns of individuals all over the world, this is actually the thing that most countries are trying to sort of struggle with. Basically, one of the main reasons that we have this question of health versus wealth is the nature of the disease itself. So infectious diseases are disruptive diseases. So just to put things in perspective, all of us have heard of the Ebola outbreak. Basically, the Ebola outbreak was intense for 18 months to 24 to 2 years. It had significant social and economic impact on many West African countries. But if you look and examine at the number of total cases, it's around 28,000 cases. So if you compare this with, say, maternal deaths or childhood problems, then this is really not a big problem. But that's the nature of infectious diseases. And COVID-19 is a prime example of that interplay between economy and health. So we thought of starting off by showing you a little bit of the data that is out there on what's going on currently with COVID-19 around the world with the interplay with global economics. So first of all, press play, please. So first of all, if you look at the cases that has happened by continents, we see that the pandemic started first in Asia, then the second big cycle happened in Europe, and then it ended up being a big problem in the US. Next, please. This is a very interesting depiction of what's going on with respect to the GDP of the different sort of groups of countries. So if you look at the green dot, the green dot was what really happened in 2019. The blue dot is the projection based on March 2020, and then the shade that you see before that was the projection in November 2019. So basically, you can see that approximately for every region in the world, there has been a drop. The biggest drop that you see is in the G20 group, specifically in emerging countries. So in 2019, the growth projection was around 4.1 to 4.3. Then the projection for 2020 was higher than that. It was approximately 4.5%. And because of Corona, that has dropped to below 4%. The same is also the case all over the world, including perhaps the biggest drop that you can see is in China. Next, please. This graph shows that in terms of GDP loss, we see that the biggest hits, four actually of the top biggest hits were in Euro zone. So we're talking about Italy, Spain, France, and Germany. And the interesting observation in this is that the lower three countries are countries that are in Asia who by all means were able to early on sort of control the spread of COVID-19. Next, please. This sort of translates what actually happened with COVID-19, which is the fact that there has been a significant drop between the Q1 of 2020 and Q2 of 2020. The biggest drop has happened in the US, as well as in Europe and Central Asia. Now, an interesting observation is both Arab states as well as Africa. So a question that may come up is, why did that drop happen in these two sort of regions of the world, although they weren't as hit as other regions? And the reason was that, fortunately, that both of these regions early on, once the spread of the pandemic started, have put on restrictive measures in terms of lockdowns for different sectors within the economy. Next, please. We are all following what's going on with the US in terms of the unemployment rate that has increased significantly because of COVID-19, reaching between 33 to 35 million individuals who are unemployed, translating into around a 14.7 unemployment rate, which is historically low. And this is a challenge that is, I do not want to say that is unique to the US, but definitely the US is facing one of the greatest challenges when it comes to economic activity, specifically translated into employment rates. Next, please. And because of that, many countries around the world have offered or started stimulus packages for the economy. Those packages included loans and grants, as well as assistance to small businesses, to large businesses, and directly to citizens. So the biggest package happened in Japan at around 20% of the GDP, followed by the US at around 11%, and then it goes down to include different countries. Next, please. So this is sort of one of the key figures in what we're showing, which is the hope of potentially what will happen. So the hope is that the world economy overall would be able to bounce back with sort of two questions in terms of the bouncing back. The first is, when will it happen? And the second is, how deep would the reduction in GDP growth be before we see that sort of increase? The projections from the IMF estimates that the biggest hit would be in the Euro area. The least would be in China, with a healthy bounce back of around 9.2%. But again, the question is, when will we see that? Next, please. Okay, so those are some of the charts that we had for you. I'm going to discuss a few points that are sort of worth mentioning vis-a-vis the whole issue of global health versus global economics. The first is that it's clear that there's no country in the world that is economically or epidemiologically immune from COVID-19. We have seen that all over the globe. The second fact is that in the absence of either a vaccination or a treatment, preferably both, it's not clear that the path back towards a normal economy would happen. And the best estimates are putting this at Q1 of 2021. So for the vaccination, which is the more relevant for the economy. If that happened in early 2021, the challenge is not only finding the vaccine, but also having the ability to roll it out to enough countries to boost the demand and sort of have enough to sort of reboost the global economy in general. Third, in the absence of a vaccine and or a treatment, and preferably both of them, what will happen and what's happening now is that many countries are benefiting from the reduction in the incidence, in the number of new cases, to try and relax the lockdowns and to lock down in different phases. And actually we at the Global Health Institute have produced a sort of an overall guidance on what are the steps that should happen there. Now, the question that is important moving forward is what will happen in two scenarios. The first is what will happen if we have a resurgence of cases, and a real life example is what's happening in Lebanon. So in Lebanon, currently we have a resurgence of cases, and that is mostly attributed by expats coming back. And the second thing is, how will the world react to a potential second wave that most are assuming will happen in the fall? Unfortunately, it may coincide with a flu season, which by itself is a little bit concerning. As it stands now, I personally do not believe that the world will be able to sort of sustain a strict lockdown as it did with the first wave. Economies will collapse, and no political party, no government will be able to handle such a decision. So the question is then, what will we do? It seems like from all of the economic modeling that is happening, the answer still goes back to three facts, which include social responsibility, and that is as simple as social or physical distancing, wearing of masks, and washing of hands. So this is one. Second, having a smarter sort of economy. Smarter meaning that anything that can happen through distance, online, whatever it is, those sectors of the economy should remain until a vaccine is developed. And thirdly, trying as much as possible, with the inability to impose another lockdown, is protecting the vulnerable. And by the vulnerable, mostly we're talking about people who are older in age and people whose immune system is a little bit compromised because of comorbidities. So three things: social responsibility, being smart in terms of changing economies, changing the configuration of the economy, and thirdly, protecting vulnerable segments within the population. So I think that is my contributions before Professor Sullivan comes in and we both take the Q&A. Richard, floor is all yours.
Shadi, thank you very much indeed, and it's absolutely wonderful to be here. Hello, everybody. I'm Richard Sullivan. I'm speaking to you from Guy's Hospital, which is in the centre of a very quiet London at the moment. And we're delighted to be doing this webinar with American University of Beirut and the Global Health Institute, who are major partners with us on this Research for Health in Conflict program that we've been running for a couple of years now. So I'm going to layer on what Shadi's already told you about in three sort of distinct areas. I'd like to just reflect a little bit about what we knew about health and wealth prior to the pandemic outbreak. I also want to just add some more data and details as well onto the unfolding economic impact, because I think looking forward, and I agree with Shadi, this is there's often a great deal of despondency around this. What we have to be able to do is look forward with solutions and with hope. So let me begin prior to the pandemic, and I just want to pick out three broad areas. 1963, the great economist Kenneth Arrow published a marvelous paper in the American Economic Review where he talked about uncertainty and welfare economics of medical care. And Kenneth Arrow, along with John Hicks, won the Nobel Prize in 1972 around social choice theory. Now, what was remarkable about that paper is he made the point that health and wealth essentially were false dichotomies. And really what we have to think about is welfare, not just wealth per se. A few years later, a remarkable British physician published in The Lancet in 1971, the inverse care law, which basically said the availability of good medical care tends to vary inversely with the need for it in the population served. He also argued that the inverse care law operates most completely when medical care is most exposed to market forces. And indeed, in the sort of 20 years preceding this pandemic, we've seen a great deal of this play out. And that, of course, this has culminated in the drive for universal healthcare and with the new sustainable development goals and the real focus on public health expenditure. In parallel with all this, lots of people have been studying inequalities. And I just want to pull out a marvelously instructive paper from 2015, published in Social Science and Medicine, looking at income inequality in health. Authored by one of the great experts in this area, Richard Wilkinson. And as he points out, when you look at the most parsimonious explanation for the effects of income inequality, it's that larger income differences really increase social distances, accentuate social class or status differences. And really, income inequality is most closely related to health when measured across whole societies. So rather than income inequality essentially being a new or independent determinant of health, it's likely that it acts through many causal processes that affect through social class and imprints on people's lives. So income inequality is really important, but it's a surrogate measure of other things. So with all of this knowledge, we of course then have the impact of the COVID-19 epidemic. And just to sort of layer on again, the global economic impact, it is absolutely dramatic. We've really not seen anything like this in our lifetimes. As Shadi has already told you, the declines in GDP have been utterly staggering. For those countries that made, as he said, made a really good fist of getting a grip of the COVID pandemic very early, they've seen lesser declines in GDPs. But the estimates are some countries which have lost control will lose between 9 and 12% of their GDP. Massive drain in incomes from tourism, remittances, and commodities as well in terms of exports. And just to give you some headline figures, by mid-April, the emerging markets had seen outflows of nearly $100 billion US. So this is essentially 4 times what we saw in the last global financial crisis. We've seen massive fiscal deficits and debt obligations. We've got countries like Argentina and Ecuador, which are essentially on the brink of default now. They're almost certainly likely to default, and they will join an increasing list of those. We've seen a drop in commodity prices, current account deficits, as well as external fiscal positions weaken. And we've also seen a very strong US dollar appreciation. So what this essentially means, though, is that many countries have a large share of their public and corporate debt is denominated in US dollars. Now, if the US dollar appreciates, this really severely limits countries' ability to control their own monetary policy. So that has huge impact on these countries. And finally, something that's been tucked away, but it's been the subject of IMF reviews and World Banks is, we still don't know the true impact of Chinese debt around the world. Something like 50% of Chinese debt at the moment is hidden. And so many countries, we simply don't know how this is going to pan out. The downward pressure of COVID-19 has been across the board, and we're already seeing the direct impact of the disease, but also the impact of lockdowns and national initiatives have already started impacting group 1 disease and those immediately vulnerable in non-communicable diseases. And of course, what we see here is we see increases in those diseases coming up. As we see more vulnerable people in the non-communicable diseases getting sick, this has a knock-on effect to the wealth aspect as well and welfare. We also know that the nutrition impact around the world is going to be extraordinary. Mailer at the World Bank estimates that something like 49 million people are going to be pushed into extreme poverty. That's the lower confidence interval, by the way. And the World Food Programme has estimated that additional 130 million people in 36 countries are already going to be added to 138 million at risk of peri-starvation. What this basically means, of course, is a much greater risk of other diseases in the immediate term, and of course, quite dramatic long-term impacts as well. So the consequences essentially is that poor health as a result of the overall impact of COVID-19 on the global economy and indirectly on other health conditions will continue in a negative spiral going forward, at least over the next 7 to 8 years. So what's been the reaction and what have the markets, the big lenders and many member states been trying to do to alleviate this and start engaging in recovery and mitigation? So you've already heard a few things from Shadi, and let me add a few other things. From the International Monetary Fund, first of all, they've activated emergency lending. There's been an increase in new tools for short-term liquidity as well. So these are kind of swap-like instruments to access US dollar markets. Why is this important? It's because for many countries, accessing medicines can only be done through the US dollar. And without having these instruments to actually buy medicines abroad and import them, a lot of drugs that are needed to keep patients alive and to treat new patients will simply dry up. The IMF is looking at debt relief for around about 250 million for the poorest 77 countries. But as I mentioned before, that's really a drop in the ocean. A lot of countries, places like Zimbabwe, have still continually fallen back into debt after relief has been given. And at the country level, there's been a lot of work on social protection mechanisms, and this is important within the context of universal health coverage. Now, if you're feeling that you're an insomniac and you need to read the ultimate paper in social protection, I can recommend a very interesting, over 300-page document by Ugo Gentilini, massive paper by the World Bank looking at what countries are doing. Now, the majority are focusing their efforts on conditional and unconditional transfers. There is a small amount of food vouchers and other form of in-kind vouchers, but most of the bulk spending is universal cash transfer programs. But, and here's the big but, the expenditures are not even. What we're seeing is that high-income countries taking the bulk. So something like 488 billion US dollars have been spent by high-income countries in terms of universal cash transfer programs. In middle-income countries, the figure's only around 50 billion US dollars, of which, incidentally, 23 billion is India alone. And then you go into all the low-income category group, of which about 237 million has been spent. So there's dramatic country differences in these universal cash transfer programs. And actually, when you look at the amount being spent on social protection, and this is obviously relevant to universal health coverage in terms of allowing patients in countries where they have to pay for their own care, the money to do that, it's really a drop in the ocean. This only accounts for about 0.6% of the global GDP of 85 trillion US dollars. Where do we go from here? Well, I think first and foremost, there's going to be a need to really understand what this downturn is going to have in terms of impact on welfare and health. We've shown time and time again, academic groups, the IMF, World Bank, that policy only changes if you measure things and demonstrates the impact. Back in 2016, Rifat Turn at Harvard and I published analysis in The Lancet showing economic downturn in 2018 across OECD countries gave rise to something like 260,000 excess cancer deaths. And that's the sort of data you need to have to change policymakers' mind. There's little doubt, and again, this is just reinforcing what Shadi was saying there, that there is a real need to guard against impacts on public healthcare expenditure and also what we're seeing in progressive universalism. Sadly, on past record, we've often seen debt being serviced from public education and public health budgets, and this really cannot be allowed. even if it's just simply steady state for the next few years, money has to be found from elsewhere. And there's going to have to be some very, very creative fiscal and monetary policies going forward. And I think finally, we kind of need to look at kind of new models actually to understand the direct and indirect economic impacts for these pandemics, and indeed the indirect impacts of what we do to control the pandemics. I think one of the great failures this time is that all the infectious disease models utterly failed to take into account what the indirect impact would be for particularly for their non-pharmaceutical interventions. And that has to be one of the big learnings from today. Michael Marmot said back in 2000 that while we should not formulate policies in the absence of evidence to support them, we must not be paralyzed into inaction whilst we wait for the evidence to be absolutely unimpeachable. And I think in terms of going forward in balancing health and welfare, we do need to make bold steps, which perhaps are not as evidence-based as we'd like them to be from a scholastic point of view. So I'll stop there, Shadi. Thank you very much for inviting me to contribute to this webinar.
Thank you very much, Dr. Saleh and Professor Sullivan. I would like to encourage all the attendees to please insert their questions in our Q&A section, and our panelists will answer as many as they can. Would you like us to start with the Q&A, Dr. Saleh, Professor Sullivan? As the questions go in?
Okay. Yes.
So our first question is addressed to both of you. In the convergence period following the recovery from the virus, which sectors of the economy are likely to recover the fastest and which are likely to recover the slowest?
So take a first stab at it, Richard.
Thank you so much.
No,
I can talk, I think, from the European perspective, because we've had reasonable data on that. What we're seeing is, and it's been interesting that building construction, a lot of construction has been kept going over this period, actually. And the view is, in terms of construction industry, heavy manufacturing, that will continue. The industries and the areas that seem to be most hard hit are retail, tourism, particular parts of the food and beverage industry, which are related to restaurants as well. But as I said, I think across the world, it's going to be very different. And of course, the aviation industry at the moment is in enormous problems. You know, there are projections of the aviation industry shrinking by nearly 1/3 to 40% over the next 5 years because of the decline in global travel over the next 2 years.
okay. So I can also probably, everything that Richard said is right. So overall, the overall principle is that any economical sector that has to do with direct service to groups of people will be hit. So definitely, I think the three that will be hit the most are the aviation sector, the retail sector, and the service/tourism sector. That includes restaurants, bars, even cruise ships. Now, the bigger question there is, and this has been a discussion within the tourism sector and also the aviation sector, is that will they be able to manage moving forward, at least for the next, let's say, 12 months, having a reduced capacity? Because again, most of the recommendations is that both restaurants, the tourism sector, as well the aviation sector, operate at 30 to 50% of capacity. For many that just doesn't reach a break-even point. I think we saw what happened in the US with the flights that I believe were run by United and American Airlines, if I'm not wrong, and the planes were full capacity. And this is a disaster for either a second wave or a resurgence of the pandemic on a global level. So the question, how will these sectors survive? As Richard said, the aviation sector will probably significantly shrink, but I think the bigger worry is the tourism and the retail sector, because most of these, especially in the sort of the restaurant business, hospitality business, is that most of that is based on low to small and medium businesses. And many of those have thinner skin in terms of being able to survive an economic downturn. And I think that is what we have seen in many parts of the world, where government assistance was mostly directed at those sectors.
Thank you, Professor Sullivan. Thank you, Dr. Saleh. Our next question is also directed at both of you. What advice can be given to countries to minimize impact of COVID-19 in raising unemployment rates and increasing mass long-term unemployment?
Say that again, Jasmine.
What advice can be given to countries to minimize the impact of COVID-19 in raising unemployment rates and increasing poverty rates?
In decreasing poverty rates.
No,
So,
it says increasing. Okay.
Yeah, I think they meant decreasing.
I think they meant decreasing.
Yeah. So basically, I think that the biggest challenge with COVID-19 is that relatively long time of recovery. I mean, we've been into the cycle for approximately 3 months now, 3 to 4 months. We're going into month 4, and there doesn't seem to be a clear path out of this without developing a vaccine or a treatment being proven to be effective, or, as we said, preferably both. So in terms of unemployment rates, the governments have, as Richard said, the governments have to sort of pitch in. But the biggest challenge is how much can governments be able to sustain that sort of support. And the biggest challenge is among low and middle income countries. And this is the bigger problem. Now, we can be, I was contemplating saying this in the webinar, but the Sweden model is an interesting one, right? Because everybody is talking about Sweden and what happened there. And it seems that it may have worked. It was a big risk. I know that the UK tried to sort of toy with the idea at the beginning. Richard can talk about this more than I do, but then changed their mind. So the question is, do we think that Sweden is better off now having that sort of smart social guidelines for COVID-19? Definitely what Sweden did will help it deal with a potential second wave than the rest of the world. But I think in the absence of very, very aggressive testing, then I'm not sure that with the second wave that there would be a real solution for unemployment, especially low middle income countries, especially small and medium businesses.
Yes, thank you, Shadi. Look, I think you have to be able to unpack countries a little bit here. I think in the high income bracket, there are some countries that have done who've managed to keep their employment levels at reasonable level at the moment. All the projections are, though, that this will worsen. And I think for high income countries, the days of low taxation have ended. I think that's one of the things that a lot of the countries are now grappling with. In order to service the debt arising from the pandemic, in order to create these social networks, in order to provide lower business rates, for example, the money has to come from somewhere. So the idea now that we can have it all and have low taxes is finished. So the decisions are going to have to be made about where personal taxation and corporate taxation sits. And I think both of those areas are going to be very contentious, both in terms of personal taxation and also where very large, very wealthy multilateral corporations are going to now be told, sorry, the days of you being able to escape very large tax bills are gone. You want to operate in our country, you're going to have to pay taxes according to this formula. And then, as Shadi said, as you move down into countries which are much more fragile where this is concerned, let's take places like Pakistan, for example, that attempted to put a national lockdown in, but for a variety of reasons, and one of them being the immediate and rapid escalation in unemployment, they immediately stopped the lockdown, they pulled it. And I think a lot of countries are suddenly realizing that one has to balance up the direct impact of COVID-19 as a pandemic on your population health versus if you lock down your economy, the actual impact on unemployment and the lack of employment will have on health and the overall social capital of your country. And to be blunt with you, I think we've, in many countries, simply just went too far with the lockdowns in terms of the actual benefit they were going to deliver vis-a-vis the damage they would do to the employment sector and indirectly to access to other health services. And I think this is one of the lessons we've had to learn out of this. So I don't think there's going to be any straightforward answer for this, but I think you're going to see very much these stratified approaches to dealing with unemployment. But it is overall, it's going to go up from nearly every country. I don't think any country is going to escape that. Even my colleagues in Sweden and Norway, you take to Norway, it has sovereign credit. Even they think they're going to have increased levels of unemployment. I'll stop there. Thank you.
Thank you, Professor Sullivan. Dr. Saleh, this next question is for you about relaxation measures. President Trump speaks about reopening the country in almost every speech. He often makes reference to the economy whenever he is asked about the virus. GHI recently published a report on relaxing measures to reopen Lebanon. According to the report, to which extent does one take precedence over the other amid the overlap in two crises in Lebanon, both the economic and the health crisis?
So to start with, and I think that's the interesting thing about COVID-19 is that there's nothing easy about it, including this question. So basically, for the first wave, or to start with, the scare that COVID-19 has caused, as well as a little bit of surge capacities in economies, allowed for many countries, almost all countries, to put in place lockdown measures. I think this is not sustainable in the second wave or in the resurgence. It's always good to make this as practical as possible and as sort of close home as possible. If you ask any person who is now pushed out of their jobs or whose income has significantly gone down, would they prefer to have an 80% chance of losing their job or a 5 to 10% chance of getting COVID-19? I think they would prefer not to lose their job. And I think moving forward, unfortunately, the choice will be that for many. So the example that Richard gave about Pakistan, I think is also happening in many other emerging economies, including Turkey, and countries within our region, including Egypt. It's an untold sort of understanding that for these countries and others, the decision has been made about preferring to keep the economic sort of cycle going and risking a little bit in terms of how strict the lockdown measures are. And I think that the US is also grappling with this fact, and we have seen folks with on both sides of the discussion. But I think that the overall trend, the overall sense is that folks prefer that to have the economy sort of restart, reboosted, whatever.
Thank you, Dr. Saleh. Professor Sullivan, this next question is for you. As per the work of R4HC MENA, how do you foresee this crisis affecting income inequality in conflict-ridden states?
Yes, conflict. So let me just unpack what we mean by conflict-affected states. There are wide and various conflicts going on around the world. On one hand, we have, for example, the narco war conflicts going on at the moment in Mexico, where we're seeing, of course, the pandemic actually driving up violence. And the reason being for that is quite simple, that obviously the demand for the narcotics is drying up, the routes are drying up, and also accessing the chemicals to refine the drugs are drying up. So we're seeing increasing violence between the different narco groups in that country. And that's having obviously knock-on effect to employment. So not only is employment being depressed there because of the general lockdowns and interventions, it's also increasingly being depressed because of the impact of escalating violence. We then have kind of areas where it's been quite, I wouldn't say it's been equipoised, but there are various countries, non-state armed groups, where we've not really seen any change from baseline. And I'll give you an example here is South Sudan, a long-running, fragile, low-income, conflict-ridden country, where essentially, although the C-19 pandemic has appeared within the country, this is a place where only 2% of its population is above 65 anyway. The measures that have been put in place are quite frankly half-hearted, but really the income inequality hasn't changed because it was already so bad. I think where we're most concerned, I think from R4HC, is where you have countries which are relatively permissive, have been impacted by conflict in terms of being hosts. So Lebanon, Turkey, Jordan, where we're seeing essentially these countries now were already on the edge of only just about being able to cope with hosting refugee populations. But obviously now, as C-19 has depressed their economy, it's going to be even harder. And this comes in and it talks to the way that the international community has to ramp up its support for all these particular countries. If there's an expectation they will continue to host and look after refugee populations, this is going to be absolutely essential. And the second thing to say, I think more generally about the humanitarian crises, a lot of humanitarian organizations have been told to move money which has been allocated to child and maternal health, NCDs, and use it in the pandemic response. Now that is substitutional. This money should be really additional. The money that should be coming in to deal with the COVID pandemic, to prepare, to test, to look after patients should be additional. But many humanitarian organizations will tell you it's having to be substitutional, and it's substitutional, it's being taken from other healthcare areas. That's extremely bad. It's bad news for other diseases, and it's also bad news because it sets a precedent about where we cap our funding for these organizations. So I think, you know, our experience in R4HC has really been about looking at these issues, illuminating them and actually measuring them, because again, policymakers only act when there's real data there to force their hand. So I think that's crucial, and that's where AUB, Hashatepe, King Hussein, and Birazé have been absolutely instrumental in doing that sort of research. Thank you.
Thank you, Professor. Our next question is for both panelists. Besides COVID-19 having negative impacts on both health and the economy, the globe is becoming more unified against one common threat. In your opinion, would COVID-19's response and strategies be a chance to have a universal economic and health income approach?
So I will take a first stab at that, if I may, Richard. I think that, and it's always difficult to say that, but COVID-19 showed how far we are from universally acting on a global challenge such as this one. If you look at the different countries, each individual country, their first reaction was how to keep as much of whatever it is, be it PPE, be it certain medications that were hypothetically beneficial against COVID-19, keeping as much as that within the borders of the country. Not only that, but we had in the global market of PPE, we have the rich countries actually outbidding poorer countries for PPE, ventilators, and what have you. So unfortunately, what this has shown, and I think that we will get to a point where we go and do sort of an evaluation of what, deep dive on what went wrong. But I think that COVID-19 has showed that we cannot, or we do not yet have the mechanism to work universally on a threat at this level, which is very unfortunate. And I think once the dust settles, there need to be a sort of a thorough discussion of what can be done in order to move in that direction.
Yeah, I'm going to be even harder, actually. I think this has been in nearly, if you were to grade in school grades, most countries' responses, they would get Fs in this. And I include my own, I'm afraid. There's an interesting paper that's just come out looking at the Global Health Security Index and looking to see the rankings on those countries that supposedly were prepared and or should respond properly. And they basically, it's very comical, it's only very short, they basically showed it's complete fiction. There was no relationship between that index and actually what happened with those countries. COVID-19 as a pandemic, essentially as a global transit ischemic attack. It's really a wake-up call. This is a virus with an infection fatality rate of about 0.4, 0.3, 0.4. The last coronavirus we dealt with, MERS, the Middle East Respiratory Syndrome, had an 80% ITU across the board of age groups and had nearly a 35% case fatality rate. Now, as Shadi said, if that kind of virus had hit our shores now with this sort of infectivity and spread, we'd be in a lot of trouble, a lot of trouble. People think this is trouble, but it's not. And it was interesting because Bill Gates talked about this at the World Health Summit a while ago about the impact of a potential really serious pandemic on the world. As Shadi said, you know, countries, it's been every person for themselves. There hasn't been the kind of solidarity we all thought there would be. I think we're going to have to really rethink very hard how we data share across countries. And I mean data share in terms of hospitalizations, levels of infection. We're going to have to think very hard about how we actually prepare for the next pandemic in terms of stockpiling PPE, testing kits, etc. And we're going to have to think about how we actually demonstrate some solidarity with those countries, which frankly, neither had the economic means nor operational capacity to actually deal with a pandemic like that. And again, I go back to, you know, the countries which are either hosting refugees or in complex emergencies. There's no doubt now, I'm being very negative here, there's no doubt now there are some islands of excellence and great practice going ahead here where there has been real solidarity country to country or group to group. So I don't want to paint a completely negative picture, but sadly, I think with Shadi, I think when the reckoning comes, the problems will deeply outweigh the successes. And I think one of the things we're going to have to be thinking about is in terms of biosecurity and biointelligence, what on earth do we do and how should we work in the next global pandemic? And at the moment, I'm afraid there's a lot of pointing fingers at people and blame making. That's all going to have to be ditched because what we've got to be able to do is sit down and constructively work out with other countries how we should act as a group, as a sort of, you know, global human community when inevitably the next big pandemic comes along, because I doubt we will be let off with something with an IFR of 0.3, 0.4 in the future.
Thank you, Professor Sullivan. We're having actually the same question come in from multiple people regarding the correlation between middle income countries having younger populations and developed countries having more, senior populations and being affected more severely. The question goes, the middle income countries that have younger populations have been circulating on media recently in the areas of health issues. Can one say that the risk of COVID-19 is not as large as in developed countries based on this fact?
So maybe, look, this is really important for people. I think there's been a lot of disinformation out there about risk. We know, broadly speaking, in the big databases that we've got now, that the majority of the risk falls on individuals. This is mortality. I'm not talking about severe COVID-19, which gets you into hospital. I'm just talking mortality. We're talking of individuals over the age of 70 that have at least one comorbidity, which on the ACE27 scale is a high grade 2 or grade 3. It's not to say there are not unfortunate people who are young, seemingly fit, who don't get this and die of it. But we see that in influenza seasons or with respiratory syncytial virus. I think a lot of the reaction has been driven by models and presumptions about what the reproduction number is and what the at-risk populations are. And the reality is, most people in medical intelligence will tell you, is what you need to be able to do is you need to be able to test your population and find out truly who has the SARS-CoV-2 virus. You need to have hospitalizations measured, and you need to know who's going into ITU. And I'm going to be blunt with you, most countries have singularly failed in all three of those metrics. They can't tell you how many people have been exposed. They can't tell you the hospitalizations, and they certainly haven't got the ITU data. Shadi?
So two things on that. The first is, and I think this is very important. We, up to this point, and I think for the foreseeable future, we will not be able to detect the true death rate from COVID-19, simply because you have so many deaths that have occurred during that time where the cause of death is not as clear or as directly related to COVID-19. I think that, again, when the dust settles, we will find out that the death rates from COVID-19 are a little bit higher than what is reported globally. The second is, I had someone actually tell me this, and I think it's an interesting observation, that it seems like COVID-19 is a rich country's disease, and I think it's not based on income. Rather, it's more based on population demographics. Specifically, I want to zoom into our region, the Arab region. The death rates that have been reported in many countries within the Arab region have been lower than other countries, with the caveat about the whole cause of death thing. And there have been two theories. The first theory, which is epidemiologically makes sense, is that the population within this region are relatively younger compared to other regions of the world, and hence the asymptomatic version of COVID-19 may be more prevalent and consequently death rates. Secondly, is something that needs quite a bit of research, and I am not sure about, but I will say anyways, which is the issue related to some sort of a gene having different version of COVID-19 that may be related to, or maybe more susceptible to, some sort of a gene makeup. Again, this for me at this stage, this is more of a conspiracy theory, at the level of a conspiracy theory, but again, it's an interesting hypothesis to test. I, as a scientist and a researcher, I tend to go more with the issue of population / age distribution.
Yeah, thank you. Shadi, I just want to add on for people listening as well. Look, it's also, I think, the COVID-19 pandemic has exposed the massive deficits in health intelligence we have around the world. We have many countries that have no vital statistics systems here, and we're talking about detecting actually a relatively complicated disease in an elderly population. So, you know, what it also has pointed out is it's no good giving hundreds of millions of pounds to modelers sitting in high-income countries. If you really want to have a good preparedness and response, fund countries' surveillance systems that actually do collect data on mortality and morbidity on the ground, real data with real people. And the days of making stuff up in models are gone, frankly.
I want to agree with Richard on that, as I do on so many other things. But I think that in many parts of the world, modeling, the modeling approach, although very beneficial in different settings, but if you had $100 and you had the option of investing in modeling or investing in improving vital statistics within countries, definitely that should go to the latter.
Thank you both very much. I think we have time for one last question, if the panelists are ready. Yes?
Yes.
As a final question, what alternative debt servicing strategies can governments take to avoid or mitigate further austerity and cuts, to example, the public health sector or the education sector, for example?
So I think what's clear is that I think the question may have two parts. The first is globally, what can happen to support countries who are in distress, and those will tend to be more, the low or middle income countries will tend to be more at risk. And I think that's a discussion that has already or is already taking place both at the level of the IMF, World Bank, and I know at the level of the EU as well. And basically there has to be some sort of a debt forgiveness plan, especially for low and middle income countries. Now, I want to separate the public health system from the education system, because there's a different dynamic in play here. For the public health system, now it's obvious. I am not sure that any single country in the world, if they were to be asked, what would you want to invest in strategically in the next 10 years, I think that public health or health systems or universal health coverage wouldn't be in the top 3 to 5. So that's clear in my mind. Now for the education sector, that's a different story, because I think now there is a need, and both Richard and I work in academic institutions. I think that there's a need for being a little bit more creative when it comes to educational institutions, and what format of education sector we want to have in the next 5, 10, 15, or 20 years. The online education was already gaining ground, but I think we have to think more strategically about how to shape it and how much to invest in it moving forward.
Yes, I would like to think that this will be an illuminating moment, that with debt there will be restructuring, the IMF and World Bank again would re-engage with countries who are most vulnerable, and that restructuring will lead to improvements. And that's the hopeful half of me. The unhopeful half of me looks at prior practice and sees lots of countries then simply slipping back into debt again, for the reasons which are already been well worn, which is around governance and corruption, fragility and conflict, external predation, etc. And we've learned about these things so many times. I kind of, in my heart, I like to think that perhaps this has scared people so much that this time when people go through the gate, they shut the door behind them and actually progress is made. I think there's going to be a lot of discussion now about allocation of resources, in terms of where, if you're going to raise taxes, if you're going to do this, where do you raise them from? And take a country like India. Do they start properly taxing the middle classes and upper middle classes and actually getting revenues flowing back into the state? So I think there are countries, the problem again is we're dealing with lots of different countries at different trajectories. And I think there's going to be a lot of national creativity, but the blockage to progress is not that we don't know, it's going to be the politics. It's going to be either the political will or the political courage to continue reforms where they may actually prove relatively unpopular in the short term. And I think that's just a complete unknown at the moment.
Thank you both very much. Thank you, Dr. Saleh and Professor Sullivan. Would you like to say any concluding remarks before we wrap up? I think we actually finished exactly on time.
Oh, thank you very much. An absolute pleasure. And thank everybody for joining.
Thank you, Professor Sullivan.
Just want to thank everybody for joining the webinar. I want to thank you, Jasmine, for moderating this and the effort you put. And I want to also thank my friend and colleague, Richard, for being part of this.
My pleasure. Always a great honor. Thank you.
Thank you.
Thank you, Dr. Saleh. Thank you, Professor Sullivan. And thank you for everyone that attended. We hope to see you at the next one. Have a nice day.
Bye-bye.
Thank you. Bye-bye.